Hello, everybody. My name is Dr. Biama Neka Onya, and I'm the Pioneer Director of the EPTH Lifestyle Medicine Center. So today we are commemorating the World Heart Day, and I'm going to be discussing optimizing heart health using the lifestyle medicine approach. Now, I'm really privileged to be among you all, among all of you in the land of the living, hale and hearty, discussing a topic that is very close to my heart. And it's actually a beautiful day to celebrate heart health, right? Because for those of us that have healthy hearts, we should actually be celebrating today. But then again, this day is meant to actually bring to the fore the fact that so many people don't have healthy hearts. And that is why we need to actually address the reasons why they don't have and how they can actually prevent themselves from having unhealthy hearts, and how they can actually manage, even when they are already afflicted by cardiovascular disease, how they can reverse and treat their conditions. So we all know that globally it's an issue, and it kills more than 17.9 million people annually all over the world. And of course, in the low and middle income countries, 60 to 70% of deaths actually occur there. And why is it so? Because we have a weak economy, we have poverty. Poverty is rife. People have poor health-seeking behavior. The health sector is not very well developed. Health insurance is not very effective, 50% out of pocket. And of course, people who are grappling with hunger can hardly afford the expensive medication. Not that even if they could, it still doesn't change the fact that if 80% of the causes of cardiovascular disease are caused by lifestyle, unhealthy lifestyle practices, then it only stands to reason that the cheapest and most effective way of preventing, treating, and even reversing the effects of cardiovascular disease is by eliminating those kind of behaviors and changing them to healthy ones. So that's what this talk is all about. Well, in Nigeria, 60 to 40% of our adult population suffers from hypertension. Stroke is rife and most people die from it. Then we have coronary artery disease that is on the rise with heart failure. Why are all these things? Then we all know that the current sudden slump syndrome that we're talking about is attributed to, like 80% cardiovascular disease. So why is all this happening? Because we have adopted the Western lifestyle. We're not moving as much as we should. We're eating processed meals, processed foods, sugar-laden foods, salt-laden foods, saturated fats, animal foods, things like rice, bread, pastries, all those things that are unhealthy, including sugary drinks and all of that. And then we don't sleep enough because we have our devices keeping us company, there's electricity, we're working late into the night, we're studying. So there's so many things. We're stressed up. Of course, the economy is something that is not smiling. And, we're taking harmful substances to drown our sorrows in alcohol and taking cigarettes. And what about stress? We all know that the current economic downturn, which is actually global, has taken a toll on our stress levels. But then we can actually do something to cope with it because stress is part of life. Then harmful substances. We find ourselves drowning ourselves in harmful substances like alcohol, cigarette smoking, other substances. And of course, those take a toll on the heart. So what about social connectedness? You might think it's not important, but along the line, I'm going to tell you that it is. So let's come down to brass tacks. What exactly should we do to prevent, treat, and even reverse cardiovascular diseases? Lifestyle medicine is the bushioning field that has championed that and has been accepted globally. If you actually check your clinical practice guidelines, they are very strong on lifestyle modification. So there are 6 pillars of lifestyle medicine. By the way, what is lifestyle medicine? It's an evidence-based lifestyle interventions that are designed to prevent, treat, and oftentimes reverse chronic diseases like cardiovascular disease, diabetes, hypertension, cancer, and even depression, osteoarthritis, all of that. So in this case, we're discussing cardiovascular disease. But then central to lifestyle medicine is the implementation of 6 pillars of lifestyle medicine. You know, it's a synergistic effect. So you can't just say you're going to exercise. That's not lifestyle medicine. You're just going to eat right and then ignore all the other pillars. No, that's not lifestyle medicine. The 6 pillars of lifestyle medicine have to do with nutrition. You know, what we talk about, whole food, plant-based nutrition, where we emphasize the optimization of whole grains, fruits, vegetables, beans, nuts, seeds, herbs, spices, and to kind of swap the normal meals that we're used to with the healthier ones. I mean, let's try to avoid animal foods laden with saturated fats, sugar, sweetened beverages, foods laden with salt, processed foods. These are things we should actually try to avoid as much as possible. And then, of course, take a lot of water, And we now talk about physical activity, exercise. That's actually very important because it improves the blood circulation, it strengthens the heart, it reduces blood sugar, blood cholesterol, and blood pressure levels. And so it's very important. 150 minutes of moderate intensity aerobic exercise is advocated. If you can't do that, if you're very busy, 75 minutes of vigorous intensity aerobic activity. Add to that strength training because it also has the activity, the ability of reducing, the cholesterol levels. The HDL cholesterol increases, LDL cholesterol decreases. It strengthens the heart, improves circulation, and is very important for weight management. If you have a well-rounded program also involving flexibility training and balance training, then you're on the right track. Mind you, weight management is also very important, when we talk about exercise. But then one thing you have to understand is that you don't achieve weight loss by exercise alone. Actually, diet is the most important aspect of weight loss. So exercise just contributes about 20% to it. Well, suffice it to say that it's very important. Exercise is very important for weight maintenance and prevention of weight regain. So the next pillar is avoidance of harmful substances. Now, smoking is very important for you to stop because it's implicated in clogging up arteries, increasing plaque formation, clot formation. So you have situations where you have stroke, you can have peripheral artery disease, you have coronary artery disease. So you don't want to have that. Alcohol increases your weight. So you don't want to have alcohol. It has direct toxic effect on the heart. So you don't want to have that. And you might want to actually quit taking alcohol. Initially, we were talking about moderating it, having 1 unit daily for women and 2 units daily for men. But now the teaching is that if you can actually cease taking alcohol or take it as sparingly as possible, that will be great for you. Now, stress management is another pillar which is also very important. We should realize that stress is an inherent part of life, but we need to learn how to manage it and how to cope with it throughout life. So one thing we need to do is we need to realize that exercise is very good. Simple things, even the food you eat, fruits and vegetables have been shown to improve decrease your stress levels. Exercise has been shown to do that. Social connectedness has been shown to improve your stress levels. And we also have mindfulness-based stress reduction strategies like mindful yoga, and then several types of mindfulness that can be broadly subclassified into formal and informal mindful practices. We have muscle relaxation techniques, we have breathing techniques, and all these can be learned. If you come to the Lifestyle Medicine Center, we'll teach you how. Now, there's also something called social connectedness. I'm sure you'll be wondering why we're talking about social connectedness in relation to heart health. But then it has been shown that social connectedness helps with stress management. It helps with reduction of mental health issues like anxiety, depression. It helps with reduction of blood pressure. And of course, when I say it helps with reduction of stress, I mean, we all know that once you're stressed and you go and rant away to your friends, go and gist with them, you find that you feel better about it. And so it's a very crucial aspect of heart health. What have I not mentioned? Sleep. Sleep is another pillar of lifestyle medicine that often gets overlooked. And why? Most clinicians are not going to be remembering to ask you about sleep, but it's also very important because if you don't sleep well, there's an increased propensity to having inflammation, blood pressure increase, blood sugar increase, cholesterol increase. You have stress, an increase in stress, and there's something we call sleep hygiene, and it's advocated that you sleep for at least 7 to 9 hours a day. It's not a waste of time at all. Now, other considerations in optimizing heart health include weight management. Weight loss, very important. And if you actually diligently follow the lifestyle medicine pillars, you will achieve that. Then prevention of the risk factors like hypertension, diabetes, hypercholesterolemia, that's high cholesterol levels in the blood. Those can also be prevented or treated through lifestyle medicine. So you can see it's a bullet that hits several targets at the same time. What about those that already suffer from cardiovascular disease? There's something we call cardiac rehabilitation, and it's hinged on lifestyle medicine. The first thing we do, and what is cardiac rehabilitation? Actually, it's a system we use, an approach, to actually treat and reverse, the symptoms of cardiovascular disease. And how is that done? Initially, we assess the patients. Then we put them through a structured, medically supervised exercise program. We give them counseling on healthy lifestyle, which is essentially lifestyle medicine. And then we also give them emotional support. And then we ensure that we take care of all these other risk factors like hypertension, cholesterol, high cholesterol levels, harmful substances, all of that, which are risk factors for cardiovascular disease. And then we follow them up for a long time. So that's basically what we do. So you can see that it's not just for prevention, but actually very essential in treatment. And I don't think anybody should feel threatened because I believe in collaborative care. So cardiologists should feel free to send their patients to lifestyle medicine physicians to be co-managed. I would like to end by reiterating what I said. I said the 6 pillars of lifestyle medicine: nutrition, physical activity, which includes, by the way, reduction of sedentary activity. When you're in a reclining position for a very long time, and like sitting and lying down, very low energy expenditure. And once you do that for prolonged times, it's an independent risk factor for cardiovascular disease, even though you exercise daily. Then, of course, I talked about stress management, and that stress leads to hypertension. It also leads to diabetes. It leads to a whole host of things that could actually make you, adopt maladaptive stress coping mechanisms that could get you off the radar. This maladaptive mechanisms like eating unhealthy stuff, not sleeping well, not exercising, and so that's very dangerous and has to be tackled. Then, of course, I talked about social connectedness and the importance of it. I talked about sleep and its importance, and finally, I talked about the use of harmful substances. So if we can do all that, then we should be on the path to a healthy heart. In conclusion, I would like to state succinctly that heart health actually entails behavior change. And that means you have to take your destiny into your hands, so to speak. So you have to actually own it. You should not, you should actually shelve this peel for every ill approach that we usually have here. So you need to take responsibility for your actions, for your choices, for your behavior in order to optimize heart health. And we'll be here to actually assist you. We are at the UPTH Lifestyle Center. My team and I will be glad to have you and to help you in your journey to optimal heart health. So God bless and thank you for listening.